Greetings. Thank you for joining us today. You're watching This Is My Health. Remember, our mantra is to give you information that you can use to take care of yourself, to look after your health. Remember, your health is the absolute wealth that you have. You cannot outsource your health. You cannot depend on other people to make you healthy. It is up to you to make sure that you utilize the information you have. In this series, we are looking at HIV/AIDS, infectious diseases, and reproductive health. And today we would like to zone in on issues around HIV/AIDS treatment. Remember Dr. Kuruza? I've asked her to come again today, to come and join us because she is an infection specialist and she's coming to help us with HIV and AIDS. Thank you so much for agreeing to come back on set once again.
Yes.
And I am at my favorite place. You know the drill. Would you like something?
Yes, of course.
They are very good at giving, yes.
Yes.
What would you like to have?
I like strawberries, some crackers, and water.
Oh, okay. Thank you very much. I think that will be coming. Now, without much ado, let us talk about this treatment. Actually, the last time you were here, we talked a lot about many things. We didn't spend enough time on treatment. I think it's a good thing that you've managed to come back. Now we can talk about treatment, although I would like us to focus maybe more on the HIV treatment. Yes, ma'am.
Yes, HIV treatment.
Thank you, ma'am.
A lot has been done since the discovery of HIV.
Which was by when? You know, there's many people after a while who even forget how long we have had the virus around.
Yes, from the 1980s. So that time when the first HIV case was discovered, there was no treatment. Many people were dying. But a lot of work scientists have done and managed to discover life-saving treatments, which we now call antiretroviral therapies. These are medications that work to attack the HIV virus. Unfortunately, they don't cure the virus, but they do paralyze the virus adequate enough to be able to afford the one who's infected a good quality life.
You took the words just out of my mouth. I was just about to ask that because one would be wondering, sometimes when you talk about bugs, we get medication and somebody has been taking for so long. And the question is, why am I taking all this and I feel fine and you tell me I still have the virus? But it's good you answered to say they don't cure. Why don't they cure?
Yes, the HIV virus is very tricky. It changes itself multiple times, and that changing is making it difficult to be able to find something that can eliminate the virus. We have not lost hope, though. We are hoping as more researches are ongoing, something will be found in the future to find something that can completely eliminate it. But it's mainly its character of changing itself that is making it difficult to find the cure for the virus.
Are all antiretrovirals the same?
No, they are not.
Okay.
Yes,
they are
not.
Different types.
They are different types. We can talk broadly about two types, being the pills or the tablets, and then the shots, because now we do have injections.
Oh, okay.
For
We have come a long way, yes.
Yes. But when we talk about the pills, which is the longest one that we have had available, even within that, there are different types. But the type depends more on how it's attacking the virus. For example, you will have those that stops the virus from entering our body cells where they go and multiply. So that medication will stop that. Then you will have the type which prevents the virus itself to multiply once it's inside the cell.
Okay.
Yes. And then there are those that will just paralyze the virus and make it inactive or not do what it wants to do with our body cells. Yes.
So that even though it's not killing it, but it is rendered imprisoned in a way.
Yes, it's rendered in prison. And I'm mentioning this because since we are talking about treatment, for treatment to be administered, it's usually a combination. It's not just one mode, it's a combination of
So
these.
sometimes you may be having those that stop it from coming in, and you say those that stop it from multiplying, and those that stop it from moving around.
Yes.
Then you take all three of them.
Yes, all three of them mixed together somehow, you get that. As I mentioned, that we come a long way. You know, many years ago, before things improved to where we are now, these medications would be given as one.
So you'll be having the 1 or 2 that stops it from growing, 1 or 2 that stops it from moving, and 1 or 2 that stops it from multiplying.
Yes,
Okay,
yes. But then this got improved into combining these actions together so that when they attack the virus, they actually bring about a more effective fight towards the virus and be able to minimize it from doing whatever it wants to do with our body.
So when you say combination, it means you move from taking more than 1 pill into now doing 1. Is that what you mean when you say you're combined? Or am I still supposed to take 6 pills, 2 of this type, 2 of that type, or whatever numbers?
No, actually the good news is combining from taking multiple at a go to taking 1.
So I actually come to a point where I'm just taking 1, and that 1 pill does all those corners and things that you talk
because
about.
it has all these mixtures that we are talking about. One is stopping it from entering the cell, one is stopping it from multiplying. So all that mixtures, they are in 1 pill, and all you do is take 1 pill once a day, for that matter, not even multiple times a day.
That's even better than some high blood pressure medication.
Absolutely.
You know? No, this is really good news, because some of the things that I used to hear is this term pill burden. That there were a number of people who were not very faithful to taking the HIV medication. They will get tired from it because it was like breakfast. So you have the food and then you have another cup of medicine. And you know, HIV doesn't stop someone from getting other diseases. I just mentioned blood pressure. So I'm imagining if you've got your blood pressure, your sugar, it was a mess. That's really good news.
Yes, it was really difficult, especially when you had to take it multiple times a day.
Yeah,
I
that
remember
was
there was that era where we used to have, where people were taking 2 in the morning, 2 in the evening, or 3 in the morning, 3 in the evening. So you can imagine if you are having other medications, what happens. Yes. So really, this has been a brilliant way of approaching this virus, to combine things. And
that should actually mean health workers should encourage people now to take their treatments, because it makes it easier for them to take medicine. There used to be a time where I used to hear, I don't know if it's still true now, that you have to take this the medication at a particular time. You know, at 7 in the morning and 7 in the evening, otherwise there will be issues. What do you have to say to that?
Yes, that is true. And you know what? It's not just true for HIV medications. Yes. When you take medications, let's say this medication is given once a day. The concept with that is this medication stays in your body system for 24 hours at a level which is supposed to cause the effect that you want from it. Yes. So when it's twice a day, it's 12 hours. So it's the same with the HIV medications. When we say once a day, every 24 hours, we want to top to that level which we know will produce the results that we want. So it becomes very important, because when you take late, you have allowed the level to go low, and now there's a risk that the virus can get used to a low level and develop resistance.
Then starts to, yes.
When you take early, you are taking it when the level is still high or adequate as where we want it, and now there's that risk that you can develop toxicities in case there's
so
any
the amount
toxicities
in your body, it becomes a problem.
A problem, yes. So it becomes important that you try to speak around the time, maybe 30 minutes before, 30 minutes after. One can do that, but not too much, because then it gets longer.
Okay. Now, I think maybe if somebody could identify that with like pain medication. Because if you don't take it, then you start feeling the pain. Isn't it with virus, you don't feel it? I can imagine when the concentration of the pain medication goes down in the body, then you begin to feel the pain.
That's an excellent
So
example.
I think that will be one way to look at it. But now what happens if you miss for the day? Do you now have to take 2 tomorrow? Because so that I can get the concentration?
No, you don't take 2 for tomorrow, because then the toxicity will be too much, or the concentration will be too much. But by far, the encouragement is not to miss, because those are some of the risks that people can pose to themselves by not knowing what to do. Some, they would want to take double, but now it's gonna start affecting their body in a negative way. Yes, so
what do you say to me? Because to forget is human. I know I'm supposed to take it at 7 p.m. every day, but hey, that movie, you know what I'm saying. By the time I remember next day, I'm not so sure. Do I take it in the morning? Do I take the one for yesterday, this morning, and then the one for the evening, take it back? Do I miss the whole day and wait until 7 p.m.? Do I go at 7 p.m. and take both of them? What do I do when I miss my night dose?
yes, before answering that one, I'll still go back to wanting to emphasize on not missing.
Don't forget.
Yes, don't forget.
Yes.
And the way you can remember or remind yourself, we always say, especially that the tablet is one tablet once a day. You try to put a time that you know it will work best for you. For example, if you want to take it after your breakfast, then you know you take your breakfast at 8 o'clock. That's a good reminder for yourself.
That whenever I'm eating and
Yes, or you want to take it before you go to bed, before your worship or your prayer, and you are praying at a specific time.
I like that. People who pray regularly, they tend to actually have a much better routine than the rest of the people who don't.
Yes, so that way you will be able to remember. But for some weird reason, on what you were asking, if you have not or you have forgotten to take, please don't take 2, because then you will be overdosing. Yes, but you have to make sure.
Do I take it as soon as I remember? Is that the idea?
It's going to depend.
Or do I wait until the next time I'm supposed to take? I think
you
that's
wait until the next time you are supposed to take. Yes.
Okay.
For example, or largely it depends on when you forgot. Let's say you were supposed to take at 8 o'clock. Then you are remembering at 10. It's still a reasonable time you can take. But if you are going to be...
It was 8 p.m. and then I went to sleep, and I remember when I wake up.
Yes.
I still take.
No, you won't take. Okay. You will wait for the next dose. Yes.
Let's go for a short break. I think I like this. When we come back, I want to hear more about the vaccines that you were talking about. Please don't go away. We'll be right back. Welcome back. If you are just joining us now, you are watching This Is My Health. We are with Dr. Kurusa, an infection specialist in the studio, and today we are talking HIV treatment. Welcome back, Doc.
Thank you.
Before we went out, on our short break, we were talking about the pills. You said you've got the pills that have been around, and then you've got injectables. So before you get too carried away, can we talk about the injectables? What's out there?
The injections, basically, the same way as the pills, they are based on those combinations that we find on the tablets. Yes. So for anyone to be eligible for getting these injections, they should have had an experience with the pills to make sure that we see if they are having any side effects or they tolerate it well. Yes. So they have to have that experience. And the second thing is, for anyone who could be put on injections, you know, when we talk about HIV, there's something called the viral load. That is the amount of virus in the body. Their viral load should be suppressed or undetectable.
At a point where it can be detected.
Yes, which will be attained through taking the pills. Yes.
So you can't just jump into the injectables?
No, you can't just jump. You have to pass through the tablets or the pills first. And the reason being, for medications to get into the system when we take it by mouth, it first has to get absorbed. So when there's a reaction, it will probably be slower than when you put it through the vein.
When you take it to there, yes.
Yes, or you put it through injection into the
Yes.
muscle, yes.
Now, these injectables, do you have now to start injecting yourself, or is it something that you come and take once and go home and come back tomorrow? How does that work out?
You don't do it yourself. It's still done by healthcare providers, so healthcare professionals. So these injections, the one which is currently approved is the one that you can get once a month or once in 2 months.
Now we are talking. So is goodbye to everyday pill reminders, those of us like me who are forgetful?
Yes, it's a good thing,
Yes.
although for those who are working, they may feel still it's a lot of work to go to the doctor that frequent. But those who...
But once a month, isn't it people when they go for the refill, they still go once a month?
Well, you can go anytime in the evening at your convenience. But if you have to go and see a healthcare provider, you probably have to go within working hours at certain times.
I see what you mean. Yeah.
So what we are looking forward to is the manufacturers getting the one which is taken once every 6 months. Because that would be fantastic.
Wow.
Yes.
Now, that's great news.
Yes.
No, you are right. You have made a lot of strides on the HIV front. But I would hate to miss that monthly dose. Because then if you are like me when I said that you can forget this, then that will be a problem.
Yes, I mean, they have a very big role, the injections, because when you consider people, let's say somebody is diagnosed with TB together with HIV, TB tablets, it's maybe 3 or 4 tablets that somebody has to take, and then the HIV is one.
Also,
so if you want to reduce that pill burden you were talking about, the injection might play a role there. Then there are those who are having certain forms of cancers, or they can't swallow, or cancer of the throat. If they're getting the injection, it's a way of preventing or treating their underlying condition, but getting it through the injection.
But then you can't go and say, I want an injection. This determination, I imagine, is made by your health provider. Yeah?
It has to be a discussion with your healthcare provider, seeing what you are eligible for and what will work best for you.
Okay. Now let's go to another level. Where are we with vaccines? Because if you are looking at taking medication once in 6 months, it would look like we should be at a point where we could be able to prevent. Where are we?
That is a big one. So for the past 35 years, there have been multiple researches, multiple work done on vaccines. But unfortunately, at the present moment, we don't have any
We are not
vaccine.
there yet.
We are not there yet, but the work is still ongoing. Yeah.
So
we don't give up. Yes.
Okay. But then, in the absence of vaccines, do we have any other pills that we can be given to prevent getting HIV?
Absolutely. Yes. You know, as time goes, with all these developments, a lot of things came to being. And one of them is taking the same HIV tablets, but different from when you are giving them for treatment, which we use for prevention. One of those is commonly known as PEP. PEP stands for post-exposure prophylaxis. Yes.
So what happens in PEP?
So in PEP, you would have been exposed to HIV. For example, a healthcare worker who is nursing somebody living with the HIV virus, and they accidentally get a needle prick from them. So they can be given a tablet which is used in the combination of HIV treatment, and that tablet is going to be taken for 1 month and is there to prevent them acquiring the infection.
And that works?
It does. Yeah, there's been fantastic results with that. Yes,
that's good.
Yes. So it's exposure first, then taking the tablet.
Yes.
The other form is PrEP. Now PrEP is pre-exposure prophylaxis. So you have not been exposed to the HIV virus, but the risk is high. You know the risk is high. You know, when we are in our offices and we talk about the risk, it will be somebody who can't negotiate the sexual practices in their home, and they know that their risk of acquiring the virus from another person is high.
That sounds like good news for people who live in a violent, a GBV environment. That sounds like really good news.
Yes, exactly. So those people, we can give them the same tablets, and we give them this for prevention. It's a little bit different from the PEP, but it's also a tablet that they get. The commonest setting where I see that it's where two partners, one is HIV positive, one is HIV negative,
yes.
and they are desiring to have a child. So to protect the one who's HIV negative, first we want the one who's HIV positive to be on treatment, to have undetectable viral load. And then when it comes to attempting for conception or to have a baby, the one who's negative, we give them this tablet called PrEP. And they take it during the course while they are trying for the baby. Usually it can go up to about 6 months. But the moment they have conceived, we stop that and encourage them to use the barrier protection, which is condoms. So those are the settings for PrEP, which is very common in my practice.
Okay. If somebody has got behavioral problems, can they be on PrEP?
Like what? What do you mean behavioral problems?
Like they can't keep away from indulging themselves. They've got multiple concurrent partners around, and you said that when the risk is high. And it's the reality out there, especially among young people, that it is a macho thing to be having many girlfriends. Can the person go around and give the girls some PrEP to make sure that it doesn't affect them?
Well, we want to promote people to get to be responsible. We want to promote people to put their lifestyles in order to prevent certain things. So that will not be the first thing to think about in assisting them. We would want to advise them on certain things that they have to do, and the harm that doing that will put them on. Yes. I mean, some people, when they are in those situations, they need some sort of counseling to understand the risk that they are facing. So that would not be an immediate thing to say the tablet is here, because it may turn out that we are preventing the HIV, but there are other sexually transmitted infections. So we are not really helping them at the end.
In fact, last time we talked about some of those others, talked about the hepatitis and the like. So I suppose the cancer issues are still there.
Cancer issues are there.
The issue is not so much about just HIV. It's about behavior and behavior change. But I had to throw it in there because somebody's listening is like, yes, there's a solution in there.
That's a good one. Yes, that's a good one. Yeah.
Now, what happens then when somebody for whatever reason, they stop taking their ARVs? What are the dangers?
Yes, let's emphasize this point that the treatment for HIV is not cure.
Yes.
So when you are being told these numbers that the viral load is undetectable, the CD4 count is high, it doesn't mean you are cured. The virus is still there. Yes, and the blood might not show the virus, but the body has actually taking it to some reserve areas in our body where it will not cause harm to you. It's hiding, yes. It's hiding. So the moment you stop, it wakes up. And it's like, oh, those medications are not there. And then it starts multiplying again. So the risks that we are trying to avoid, such as immunity going down and you having opportunistic infections, you being at risk for cancers, now they are coming back. So really stopping is never a good idea.
Now that our time is up, with your last 1 minute or so, can we talk about this thing called resistance? Yes,
the resistance can happen, but it's mainly prompted by not taking medications the right way. If you don't take medications, like I said, and the body gets used to doses being low, you skipping and taking, that's when the body starts building some muscles against the virus. And resistance, we mean now the medications that you are being given
is not working. The virus has outsmarted the medication.
Yes, the medications that you are taking is no longer working to arrest the virus or attack the virus like we had said when we started.
No, thank you very much. It's been a pleasure having you here. Do you have a second last word?
Yes, I just want to emphasize the concept of immune boosters. HIV treatment works on the virus. Immune booster, it will boost our body to be able to resist infections, our body to be able to acquire the medications well, but it doesn't replace treatment. So these are two different things. They both have their role, but they are two different things.
Thank you very much. Thank you for joining us. You have heard it. I like the last point. There are two different things. And within the immune boosters, we are talking also about your diets. We are talking sometimes about herbs. We are talking about lifestyle changes. All those things that you can do to help yourself in treatment generally strengthen the body to possibly fight and produce more soldiers. But soldiers that are being killed because the enemy is not being dealt with are going to run dry. Unfortunately, sooner or later, the immune boosters will stop working. Not that they are not working, but because the can is empty. There are no more soldiers to produce. They were all killed. So in this war, we must fight on both fronts. We must strengthen our body soldiers, but at the same time, we must kill the enemy. If you are just going to strengthen your own soldiers and not kill the enemy, you are going to lose this battle. So we have heard a lot about HIV treatment. Let us take these lessons, and like the doctor has said, if you are on treatment, adhere to it. If you don't have HIV, don't get it. Let's look at our behavior and make sure that our behavior does not lead us down the path where we can get HIV. Remember, this is my health. It is your health to look after. I'm looking forward to seeing you next time. Until then, stay blessed.